Okay, so Atomic Success Secrets, and we'll do these 8 things to decrease stress, anxiety, and overwhelm. And you can do it more and more for yourself. There's maybe even a couple of bonus things in here. I'm going to just write this one down, and then we'll do the one-on-one healing, and it'll be in the Atomic Portal, and there'll be links below and around the video about all of this. So the first thing we're going to do, and we talked about oxytocin, the love hormone, the bonding hormone that's in the brain, then goes into the gut, and how important that is. So here goes. First thing that we can do, and it's easy to do at night when you're about to fall asleep, because you're just laying there anyway, or when you're watching a video, or just not doing much that you don't need to use your hands. And so one thing is an acupuncture kind of process, but use your whole hand. And we can put one hand on your heart, and then one hand on your forehead, and touch the bridge of your nose too. And so the idea is 10 to 15 minutes of doing this. We'll do it for about a minute right now, and you'll already start to feel an effect. But this takes some of that mental and emotional anguish and that limbic rage, the survival, fight or flight stuff out of the body, and connects it up to the heart. And so ideally you do this for at least 10 minutes. You know, you can pop up on pillows. You can do it laying in bed at night. Okay, after the 10 minutes like that, right now we'll do a minute. Then you connect your heart to your belly. So you just touch super light, and you know how we like to touch very, very lightly, like you're touching a butterfly. Extra credit to touch it very lightly. And so now you're going heart to the belly button, ideally for 10 minutes. But even for a minute, you can start to feel how you start to relax. And then after that 10 minutes, you go heart to your pubic bone, so the pelvis. And of course, just under the pelvis is the bladder, and then the colon, the ureters are just coming down into the bladder. So it's for drainage. For women, it's the uterus, and for men, it's the prostate. Prostate is about courage. The whole area is about manifestation. It's literally where babies are from spirit to form, from the pelvis. So you do 10 minutes to the forehead, heart to the forehead, 10 minutes heart to the belly button, and then 10 minutes heart to the pubic bone. And you just make it a habit. You know, you're falling asleep at night anyway. Do 10 minutes, and then do 10 minutes. So while we hold this bottom piece, I'll go to the next part. So if you get organic grass-fed ghee, G-E-H-E-E, organic grass-fed ghee. If you're vegetarian, maybe you don't do this. And if you're really, really sensitive to dairy, maybe you don't do it, but it does take away the ghee takes away the protein that's usually the part that makes you allergic. But you take a teaspoon of ghee first thing in the morning, before you brush your teeth even. And then before you brush your teeth at night, you take another teaspoon of ghee. And that helps soothe the joints, and it starts to take away emotional anguish. And then what you do is you take a little ghee on others, my friends. I'm going to wave to them when they go by. They just sold their running store. And let's see if they say hi. Hello, look over here. Oh, there they go. Okay, so you take your 2 fingers with a little ghee, and you go on your temples, and you just start to roll them like this. So you touch, and you can do it now. Just take the ghee and go 1, 2, 3, 4, 5, 6, and then take your index fingers and just press just lightly into the temples. 1, 2, 3, 4, 5, 6. So this takes a lot of stress and overwhelm out. It helps you sleep. The next one is some things called the Marma points, Dr. Naram, Ancient Secrets book. You could take your thumb, hook your fingers, and just press the space between your nose and your upper lip 6 times, just gently and not too fast. 1, 2, 3, 4, 5, 6. So great to do right before sleep. It'll help you sleep. Okay, the next one is another point, marma point. That's point, fleshy point right below the index finger on the right hand. You press it 6 times. 1, 2, 3, 4, 5, 6. I think I'm going to just give that one. We have other marma points too, but that'll be really, keep it simple. Okay, now we're going to do a technique, a structural technique for integrated manual therapy to open up this part of your brain, this part of your brain stem and the cranial base, the bones. And there's a hole there called your jugular foramen on both sides. And the vagus nerve goes through there, and the accessory spinal nerve goes through there that gets this muscle that gets all tense. And the vestibular cochlear nerve is right in there. So it's like all of this stuff. And of course, remember the vagus nerve innervates all those organs that you, the digestion organs that are part of your mood. So we're going to take your fingers, your middle finger, your index fingers, and go inside your ear and then hook that little flap. It's called the tragus. Hook the flap and gently pull it out. And then take your thumbs and on the bone just below the ear, the big bone, the mastoid, you're going to push that up. So the thumbs are going to push up, the little fingers looking around the tragus, the little flap, are going to pull out. They're going to pull out, thumb is going to push up. So here we go. And this one you can do for 30 seconds or a minute. I wouldn't do it more than 2 minutes. Maybe even just a minute is plenty, because it really releases a lot. So you might want to release it in little bits. And what you're doing is you're giving space to that nerve. So it's not, there's not pressure on it. Take a little pressure off of it. And you're giving space to the jugular vein, which where 90% of the drainage of your head comes from. So you're just draining your head and you're giving space to this vagus nerve, structural space. Most methods don't have a structural component to anxiety, like a way to just fix up the house. While we do this, I'll talk about another part that's really, really key, I think. Some people are, I would say, are not gluten intolerant, but pretty much almost everybody that sees me, I find signs of gluten intolerance. And there's 25% more blood flow to your brain if you are off of gluten. And there's so many studies that have shown like 300 different medical conditions that are connected to gluten. They're improved if you get off of gluten. So recommendation is 100% gluten-free. This is one of the things that helped Jen a lot. She used to have a lot of pain as a little girl and lots of problems going to the bathroom. And it was a thing. It was a thing. And all that went away and her mood got better. So, if you're not eliminating every day, you're toxic and that's not going to make you feel very happy. So, so this helps to release it. So gluten-free, peanut-free is very good, 100% peanut-free. It's a #1 allergen and it also affects the adrenals and kidneys. So it's a stress thing. So, you can do other butters, sunflower seed butter, walnut butter, cashew butter. So that's my recommendations, gluten-free, peanut-free. I recommend sugar-free, at least mostly processed sugar-free. You can have maple syrup and honey, but sugar is inflammatory. It increases stress. So you can go sugar-free. Tom G. Mateo recommends almond-free for another reason, but we'll leave that to you guys. And then I recommend eating as organic as you can, trying to not eat stuff with Roundup or Astrazine, the herbicides, the pesticides, the fungicides, because they literally poison the gut. They poison the gut bacteria, and then your gut's not happy. So if you're trying to deal with you're doing all talk therapy and trying to figure out why you're depressed or got anxiety or relationship problems, and you're eating gluten, processed sugar, and Roundup, well, you might have a deal there. If everybody's on that, nobody's going to be able to be that happy. So gluten-free, peanut-free, processed sugar-free, and mostly organic. Okay, so now we've done this one for a while, and now we're going to do what you guys are used to, which is this stuff, this meditative peace process and these other parts. So what you can do right now is if there's something that's bringing you angst. So just for a moment, we call it poking the bear. Just think of something that is on your mind, that's up for you, that's irritating, that's waking you up at night, that's stressful. It could be money, it could be a love person, a love interest, it could be a family member, it could be business, it could be your state of affairs, could be your health. So just for a moment, we'll just together think about the problem just for a bit. And then what we do is we let go of the thoughts and we go in our bodies and just notice the physical feeling. So now we stay out of our thoughts. This is the peace process. We keep our attention in the body and we just notice the physical sensation. Now you might call it anxiety, you might call it fear, you might call it anger, sadness, whatever it is it's true. And you could just go think about like, well, what does it actually feel like? What's the physical sensation? Your thoughts in your body and just notice the physical sensation and just follow it. And this is something that we do every day in the group, and we do it in the once a month group. We do it in our atomic group here daily. And it's just being still and noticing. There's advanced versions of this. There's next levels of this, but I want to keep this as simple as I can today. Is just be still and notice the physical sensation. When you see me and Ilya doing that big breath, it's what's called instant miracle. It's something that comes through us. Sometimes it looks like a yawn. So we're not, it's not like we're sleepy, but that's what that is all about. So that's one way to do the peace process. And now the next way that we like to do this peace process is like this. And there's more levels of this, but we'll start with one level, is just squeeze the index finger of your right hand 6 times. 1, 2, 3, 4, 5, 6. It's a point that takes you out of your conscious mind into the subconscious and the superconscious. And then you just ask that question, what do you want? It's like, what would do it for you? What would you like to create? If you could have it any way you want it, what would you like your life to look like? What would you be doing? And so now you just have a definite chief aim in life. This is the goal. If you could have anything you want, what might that be? And just play it like a movie. And some people, I was listening to somebody that I really like a lot, and he said he's been on his knees every morning for 20 years praying for something, and he finally got it. He's in his 70s. And other people, it's like so instantaneous. One of my good friends created something in just a few minutes, and then it became a worldwide sensation, and he never had to work another day in his life. Yeah, what is it that you want? And who would you be with? Because people are important. Who you're around matters. And then what we do with that vision is then we go back in the body and we notice what we notice. And you can touch your heart. So that's the manifestation part. Even press it a little bit 6 times. 1, 2, 3, 4, 5, 6. And just think very good. Like it's already done. And if you like, you can put the other hand on your belly button and just lightly touch that. And then now go in your body and notice what you notice. And let go of the thoughts. And notice the most intense part in your body, the physical sensation. And just notice it. Give it your full attention. And we can do this for a long time. This is what we do in the group. This is how we help each other out. We'll be doing the one-on-one session in just a little bit with everybody here. And you you can look at your thoughts. Are there thoughts? Is there some space without a thought? You'd ask that question, who am I? And just take a look. Just take a look. Just notice. Who am I? And then you could take a step back and just have that question, who is it that's watching? Like you're noticing, who is the noticer? Right, so now that we're all cooking, I'll turn off this part of the recording and we'll do the one-on-one session with everybody. And let's see what happens. Report in.